Hi, my name is Luke Williams, and I'm here to talk about total knee replacement recovery process and the physical therapy that goes with it. So, what physical therapy is going to be able to do for you after your total knee replacement? It's going to do a couple things. It's going to help alleviate some stiffness, some weakness, and it's going to help you with the difficulty walking that you're going to have after surgery. So, what proper rehab is going to be able to help you return to your daily activities, and with a structured program, it's going to help you gain independence faster, and it's going to help you with your long-term outcomes. So total knee replacement physical therapy is broken up into 3 stages. The first stage is going to be that prehabilitation stage. The second stage is going to be the early recovery stage, and your third stage is going to be mid-recovery stage. So that first phase, the prehabilitation stage, what that stage is going to do for you, it's going to be actually before your surgery. And so it's going to be consisting of range of motion exercises and strengthening exercises and what prehabilitation does, it actually improves and speeds up your recovery process after surgery. So with better range of motion and better strength, you're actually going to be able to regain your function more effectively afterward. So what those exercises are going to look like, so it's going to be simple, easy, functional exercises like squats, and it's going to be like step ups. So with the squats, it's just going to be like regular squats. It's going to be up and down, and it can be assisted as much as needed. So with both these exercises, it's going to be 3 sets of at least 10 reps. And so what the step ups can be, it can just be you're just going to step up on just a single step, going up with your bad leg, and then coming up and matching it with your good leg. And then you're going to come down with the bad leg and match it with the good leg. So every time that you come into the clinic to start your physical therapy process, you're going to get started on the bikes. So for your early stage recovery during that first 2 weeks, you're just going to, on the bike, so if my left leg was the one affected, I'm just going to do half rotations on the bike. I'm not going to go fully because it's not going to be possible to actually have that full extension on the knee yet, or the full flexion on it. So it's just going to be half rotations. And we're going to be doing that for 8 minutes. So when you get towards that mid-recovery stage, it's going to be that 2 weeks to 6 weeks. You're actually going to be doing your full range of motion, and so you're actually going to get moved closer to the bike, and this is going to help promote some of that knee flexion, because that's going to be one of the most important parts during this stage. So for your early stage recovery, which is going to be that first day after surgery up until 2 weeks post-op, there are going to be some main goals that we're going to be doing, and that's going to be to reduce your pain and swelling that's happening in your knee, and to help restore your passive range of motion for your knee extension to 0 degrees. So as we get rid of your swelling and pain, it's going to help gain a little bit more mobility back in your knee, and that's also going to help with your passive range of motion for the knee extension. So the knee extension is going to be one of the most important things that we're going to have, because it can be very challenging, and if you don't actually address it, some scar tissue can build up, and it's going to make it really hard to do daily activities. So with full range of motion on your knee extension, it's going to be easier to walk, and it's just going to be easier to do daily activities in general. So the exercises that go with your early stage recovery, but are not limited to, are what we call quad sets. Which is going to help with that passive knee extension to 0 degrees, seated knee extensions, and weight shifts, which is going to help your neuromuscular function. So that first exercise, quad sets with a ball, what that's going to look like, you're going to grab a ball, or you can grab a towel and roll it up, and you're going to put it under your affected leg, and all you're going to do is contract your quads and try to push that ball into the table. So you can do this on your bedside or on the floor, for whatever is going to be most comfortable for you. So you're going to do that for 3 sets of 12 repetitions. For that next exercise, is going to be your passive knee extensions. So with that passive knee extension, you're just going to have something, again, just underneath, but this time it's going to be underneath your ankle. And so you're going to try and get your knee to come down and rest as straight as possible. So you're not going to be able to get at early stage in your recovery, you're not going to be able to get this far, but you can even put a little weight on it to help get that knee extension to 0. That next exercise is going to be your seated knee extensions. What the seated knee extension is going to look like, it's going to be really simple. You're just going to be sitting on your bedside on the edge of your bed, or you're going to edge of a chair if it's tall enough, and you're just going to extend that knee until it locks out and come back down. Extending the other knee until it locks out and come back down, or at least as far as you can. So you're going to do that for 3 sets of 12 repetitions. For that final exercise that I'm going to show you is going to be that weight shift. So what all the weight shift is going to do, it's going to be very simple. All you're going to do is shift your weight to that affected leg for 5 seconds. You're going to do 5 seconds for each leg. You hold each one for 5 seconds, and you're going to do that for 3 sets of 8 repetitions. So after every physical therapy session, you're going to get something called electrical stimulation. So what electrical stimulation does, it stimulates your muscle to activate it when it's hard to voluntarily contract it on your own. And with that, you're also going to have something, you're just also going to have ice that goes with it. So electrical stimulation might be something that you can only get in clinic, but at home you can ice as often as you'd like. So for every time you put on ice, it's just going to be on for 15 minutes. You're going to do that for every 2 hours. And as long as you're feeling pain and you have inflammation, it is best recommended to ice as much as you can. Okay, so for your mid-stage recovery, so it's going to be that 2-week post-op to your 6-week post-op time span. So some of the primary goals that we're going to be doing is going to be that improving your range of motion. And if you haven't gotten 0% or 0 degrees on your passive knee extension, that's going to be one thing we're really going to harp on. And another thing is going to be your knee flexion now. So knee flexion is now we're going to try to get it to 120 before we discharge you. So this whole goal of this stage is going to be getting that knee flexion, building strength and coordination, and start transitioning to more of an independent lifestyle. So you're no longer be on any crutches or anything like that. Try to ease off the canes as we get closer to your 6-week mark. Okay, so for your mid-stage recovery, some of those exercises are going to look like knee flexion drills. It's going to be sit to stand exercises, and it's going to be just walking patterns and gait exercises. So what that knee flexion drill looks like, with that affected leg, you're going to wrap around a strap, or at home you can use something like a belt. So all you're going to do is you're going to just using my leg, I'm going to pull up as far as I can go. And then once I've gotten as far as I can go, I'm going to pull with the belt to try to get more flexion in my knee. Then I'm going to slowly come back out. Now I'm going to do that for a total of 2 sets for 10 repetitions. I'm going to come up just using my leg, and then at the end, I'm going to pull with that belt. So your next exercise is going to be something called sit to stands. Very simple. It's just coming down. You're just sitting in a chair, and you come back up. You're just as simple as it sounds, sitting and then standing up. It's going to help gain just your independence and your general strength. And what your walking drills are going to look like, that's mostly going to be in clinic, and we're going to help you actually try to get rid of your limp and try to just actually be independent and not try to counterbalance anything. At the end of the mid-stage recovery at that 6-week mark, there's going to be 2 main things that are going to be measured. It's going to be that passive range of motion on the knee extension and your active range of motion on your knee flexion. So your knee flexion, if it's not at 120, or your passive knee extension is not at 0 degrees, something called manipulation under anesthesia is going to get introduced. And what manipulation under anesthesia, what that's going to do, it's going to help break up scar tissue, and it's going to help promote some mobility back to that knee flexion into that knee extension. Okay, so for some of your general discharge criteria, some of the goals that we're going to be going for is going to be restoring your normal walking mechanics and doing daily activities pain-free. It's also going to be doing, some of those goals are going to look like doing things independently, like navigating stairs, like getting up and out of a chair, and also doing daily activities and work-related tasks. So doing things like walking without a limp and without an assistive device are going to be very important during the stage. And also going back to our knee flexion. So our knee flexion, if it's not at 120 and if our passive knee extension is not 0 degrees, we're going to have a little more work that we're going to have to do. And also with some of the more advanced criteria, some people are going to want go back to sports or things like that. But even with a total knee surgery, it's also going to limit some things that you're going to be able to go back and do. So after having a total knee surgery, you're not going to be able to do things like walk or run on hard surfaces. It's, depending on what you're going back to, you're going to have to adjust and modify your training plans that you have in the future. What this project did for me, it helped me get a more insight on post-surgical rehabilitation. It also helped me appreciate and understand the physical therapy recovery process, and how essential it can be to actually improving someone's quality of life, because they come into surgery having knee pain for probably several years, and then just after a couple months of physical therapy, it's possible that they can just have absolutely no pain and have very good range of motion by the end of their physical therapy process.